So, could you tell us, ladies, what sort of things have you been working on together?
I suppose the starting point for us is that we have a strategic partnership agreement with between the Health and Social Care Partnership and Carers of West Dunbartonshire. That's in the spirit of reciprocity and the spirit of ensuring that there is no single point of failure if people move on, that we have a clear expectation for us around Carers of West Dunbartonshire, and Carers of West Dunbartonshire are clear what they can expect from the Health and Social Care Partnership. This is obviously in addition to any commissioning arrangements, but I think that gives us a valuable framework to be working with as strategic partners.
It has. I mean, I think when it comes to important pieces of work, like looking at the Carers Act and things like that, Carers of West Dunbartonshire are around the table. Our voice has been heard. We are representing carers, and we do lots of events and consultation with carers. So I think that's important to feed that in, and it also gives us an opportunity to challenge decisions where we feel that's appropriate.
So that structure allows for that.
Yeah. Yes, absolutely. Yeah. And it allows for honest, robust conversations when we are in challenging financial times. It allows us to be able to have robust conversations about what our priorities are and be honest. So for us, those robust conversations can take place around funding and priorities in a much more meaningful way. We can be honest and transparent for both organisations around that decision making. And as Kim says, we don't always have to agree on everything, but we understand the decision making of both organisations and how that governance works for us both.
Okay. And what outcomes is this sort of way of working so positively together? What's that achieved for carers in West Dunbartonshire?
I think the starting point for everybody, I think, is that we always have the carer in mind. And as Wendy says, the having the agreement in place, the emphasis on the word agreement for me, I think, is really important, because the point is to always get to an agreement. That doesn't mean it's always an easy road, that we haven't raised issues that are challenging or vice versa, but it's the understanding of what the tensions are on both sides and how we can come to an agreement that has the best outcome for the carer. So for me, I think actually it is about resources and how we can provide those services and supports to carers in the best way that we can, and that's about pulling resources together rather than us working in silos and having a them and us kind of approach to it, which I think at the end of the day only ends up punishing carers.
I think the added value that the Carers of West Dunbarton bring is really important. So while we commission what are services around support and assessment, what Carers of West Dunbarton bring to the table is that added value. They can go out and be dynamic and flexible about accessing additional sources of funding. We can try before we buy in a whole range of things and allow us to see what works and what doesn't work. And I think for me, the search project was particularly exciting around working with carers with issues of alcohol.
Yes, and that's a good example, because I can't think of any examples of where Carers of West Dunbartonshire would seek funding for a particular project without first consulting with our partners, simply because they will have an angle, they will have advice and information and guidance about what areas we should look at, how we can improve an application, or what other things we should be looking at in terms of supporting carers. And so for me, it quite simply is, why would we not do that? If the end result is supporting carer, why would we not do that? And I think the search project is a very good example. That came from us having a conversation. We identified the need, but we went and had a conversation with our addiction colleagues about, if we were to do this, what are your tensions? What would you want us to look at? How could we work together? What would be the best outcome for the carer?
Without building an expectation within our communities, we manage those expectations around what the carers expect, what our wider community expect. So we roll this stuff out in a really positive way without setting any of us up to fail. So I think that for the addictions work, it was about, if we start to work with carers, we're not going to stop after 6 months and just leave them. This is about how do we mainstream this, how do we manage it in a way that's most beneficial to carers for those that they care with. And I think for the alcohol project, what's interesting is it's a very different carer dynamic, because carers caring for people with alcohol may have alcohol issues themselves. It's a fairly chaotic caring role, because sometimes it's a very intensive role, other times it's not intensive at all. So it's the flexibility around what is a very specialist area of work, and as Kim said, seeking the advice of specialists in addiction services before we kicked off anything.
And it sounds, listening to how you're describing that, it sounds not only that you have a transparent relationship between the partners, that extends to the carers locally as well, because
Absolutely.
You're not having these unfulfillable expectations. You're being quite clear at the outset, this is resources we have, this is what we're looking at doing, and I presume you engage carers in that process as well.
Always, and we would always, and I mean, although we're sitting with Carers of West Dunbarton, our local youth work service, Why Sort It, provides services to young carers. And the other nice example is young adult carers, where we are working with them up to 25. And Kim and Gillian are working together to ensure that we meet the needs of those young adult carers. They don't fall between different services, and that we're consistent in how we provide that without imposing the way we organise services on young people. So we work flexibly around what are their particular needs, working in a GIRFEC model up to 25, but by sharing information with Kim about who these young people are, what their needs are, and tapping into those services so the young people know when they can access anything from both organisations. So that transition into adulthood has been really important. And so it's not just Kim and I, this is about a whole, I suppose, community planning and practice is what we talk about. So all of our partners within leisure, within housing, because we work with their tenants and residents organisation to share information about carer services, because the RTOs are working with all the tenants across. And it has to, because carers are caring for people who are using other services, and carers are living.
And who will themselves be using those services. I mean,
absolutely.
Carers and patients and tenants and users of leisure facilities and users of, community services. So I think in that respect there won't be terribly much changes for us, because it's a model and an approach that we use anyway. For me, it's a very sensible one, because not one service or organisation will have all those resources, and it's about finding out what's out there and connecting people to that. So I don't know that in that respect terribly much the Act will have changed terribly much for us locally, and how we approach that.
But we have used it as an opportunity to consider what we do, because it's always good to reflect and review. And so we've used that within the Carers Development Group locally to consider how we're doing things. Can we share across care groups? Can we share across the wider system? And that's what we've used the Act for, is that review and going back to carers and asking carers, what do you see as the priorities? How can we do this better? Are we not doing things that you would want us to do? And those are the conversations that we're having with carers consistently as groups, as well as sort of one-to-one within Kim's and Gillian's services, as well as having online opportunities for people to feed in to how we move forward.
That's great.
There's several things. I think one for me is locally we use a co-located model for staff. So if we are we have carer support embedded in particular services. That was initially how we chose to use Carers Information Strategy funding, and I think the advantage of that is that carers, support workers understand the tensions within those teams and vice versa. And I think that is key. Doesn't necessarily mean they'll be able to change them or have any influence, but I think when the outcome for carers is providing that good support, is having a good understanding of that, the tensions within that team, the challenges that they're facing, and vice versa, is one of the key things that makes it work, I think, because we now see as carer support is embedded across the authority. So we wouldn't look at learning disabilities or addiction or hospital discharge or older people without automatically seeing carer support as an integral part of that. And that's a model we've been using for several years.
I think from my perspective as a planning manager, it's all about the planning. This isn't an accident, this is a considered approach, as Kim says. Kim's looking at it very much from an operational perspective. This is about the connectivity vertically and horizontally, and so it's not by accident. This takes time, energy and hard work, and it also takes trust and relationships to build this and to be at this point and to ensure that we are all working collaboratively. And so while we are being very relaxed about this approach, this takes time, energy and hard work, and it takes that planned and considered approach to get to this point. It's not an accident that we work like this.
I think that's absolutely right, and I would absolutely agree. I think people often look at carers of West Dunbartonshire and carers of West Dunbartonshire and assume it's because so-and-so likes so-and-so and it's because she gets... It's not that. It's an agreement, it's a formal agreement, and both parties work incredibly hard at sustaining and maintaining it and developing it. It's part of what we do. It's not an accident.
And it comes from our high organisations, so from Kim's board and from our IGB. This is a senior management decision and a commitment from senior managers within the HSCP that this is the way we should be working across organisations and across care groups, and that consistent approach is supported. And Kim sits in the IGB, and so that representation is there, that considered position is there, as well as throughout operational services and the structures within which we work. So we've had a commitment for a long time from our counsellors, our senior managers, and certainly from my organisation and from yours as well.
And I think the key thing also is that you know, as an organisation is commissioned to deliver the services, you have to deliver. Ultimately, the important thing is that the carer is being provided with good support. But if we're being commissioned to deliver the services, we have to deliver them in the way that we've agreed to do that. That can be a fine line to walk, because we also are providing an advocacy role for carers. So there can be a tension there. So there can be challenges. It's not always easy, but what sustains that, I think, is that agreement and that mutual respect and the hard work that the investment that people have made, and not losing sight of what the end goal is.
So it really sounds like all good relationships that you both need to work at it. Everybody involved needs to be investing the time and energy. And it starts from a willingness, doesn't it? That's like your initial starting point, and then meeting each other at that place. Thank you so much. I'm sure people across Scotland will be really interested to see how this approach has worked well here, and look forward to hearing how it develops once the Carers Act is actually up and running come April 2018.
Thank you very much.
Thank you.
Thank you. Thanks.